Hi, everybody. I am so excited today. We are going to be talking with Dr. Bala about fixing your period. Dr. Bala is a women's health and integrative medicine expert. And here she is. She's joining. She believes that it's your birthright to be able to use natural options to regulate your hormones. And she's dedicated her life to teaching women how to do just that through her content that she shares on Instagram, on TikTok, and on her website, and through the one-on-one consults that she offers in person in Arizona and virtually around the world. So put your hands together and help me in welcoming Dr. Bala. Here she is. In about 30 seconds, maybe. She's joining. And hi! It's so good to see you. Thank you so much for joining us today.
Yes, I am super excited.
So, okay, the question everybody wants to know, the question that you get asked a million times on every different social media platform. We start with asking if you think it's possible to regulate the hormones without using birth control.
Yes, totally. So birth control, what it actually does is kind of covers up what's actually going on in your body. So because when we take birth control or hormonal birth control, it stops your ovulation, which means you don't get a natural period. A period is basically when you are ovulating and then shedding that lining that you created in your follicular phase, and then the luteal phase maintains it, and then if you don't fertilize that egg, you end up with a period. So to shed that lining. And so what birth control does is it stops that ovulation. So you don't have your FSH and your LH telling your egg to get released. You don't have that same stimulus and all those hormones anymore. I created like a picture. Hello Clue has really awesome pictures for it too, where they kind of show you what a normal period looks like, and like all these hormonal fluctuations are happening. And then when you're on the birth control pill, your hormones are just whatever's in the birth control. So it's kind of like a cover up for your symptoms, because now you have these new synthetic hormones in your body, but you don't have your natural hormones kind of fluctuating, which is why people who have really painful periods, heavy periods, acne, PMS symptoms, some of those kind of clear up, because it kind of just suppresses all of your natural hormonal fluctuations, and you only have this rhythm of the estradiol and the progestins in the pill. So it doesn't totally fix everything that's going on, unfortunately, because as soon as you get off of the pill, your problems might be worse or just right back to where they were in the beginning.
Right. Okay. So it works really well short term, it seems like, in suppressing symptoms.
Yes,
but
absolutely.
Okay. And then if you want to really heal the root cause of issues that you're having, it sounds like people might need to explore other options. And so what are some of the things that you try to tell people to look at as possible root causes of their hormonal dysfunction?
So, I always like to test. I want to do the Dutch test for every woman that I see. I feel like people think I'm getting paid by them, but I'm really not.
But they could pay you if you're listening.
I know, Dutch test is me. I really love doing that because it gives me so much good information into what's going on with all of your hormones. It tells me how your estrogen is getting metabolized, which pathways it's getting metabolized more down, because we have that 2OH, 4OH, 16OH pathways, and of course we want most of our estrogen to be going down that 2OH, and so it gives me insight into that. It tells me, for women with PCOS, it tells me what's going on with your androgens, whether you prefer the 5-alpha or the 5-beta pathway, right. And it also tells me about your stress hormones, how your cortisol is in relation to your cortisone, and which one you're preferring, also how much you're metabolizing of your cortisol, so how much are you making, how much are you getting rid of. So it gives me just a lot of really good information, and so I really like doing that testing, and so I feel like I got off track on your question.
That's okay. No, and so it's okay for people who are listening. So you have a bunch of major hormones in your body that we kind of make from the same basic components, right? Our body takes cholesterol and it makes estrogen, progesterone, DHEA, testosterone, and cortisol, among others. And so what Dr. Bala is saying here is that she wants to know what's going on with you. If you walk into her clinic and you're having a problem period, she's going to measure. She's not going to guess. She's going to look at what your body is doing with those hormones, because along the way, there's a lot of different steps. And it sounds like you mentioned in the beginning, there's a couple different types of estrogens. Mm-hmm. And So can we talk about that? So where can that go wrong, and how can that be playing a part in people's symptoms?
Yeah, so there's the 2OH pathway, the 4OH, and 16OH. So 2OH is where we want at least like 80% of our estrogens to be getting metabolized down. The 4OH is kind of the one that we are associating more with like breast and ovarian cancers, and also all of those PMS symptoms you have, the signs of like excess estrogen that we talk about, or estrogen dominance, I'm sure people have heard about. That is when our estrogens are getting kind of more, they're going more down that 4OH instead of the 2OH. 16OH is also not, we don't want it to be going down too much. It can be protective for bone health, but we don't want too much of our estrogens going down that pathway either. So when we see people who have really painful periods, when they have really high, heavy flows, things like that, or they're like feeling really depressed and anxious, that could be because their estrogens are kind of going down that 4OH pathway more than the 2OH pathway.
Gotcha. Perfect. Okay, so guys, this is why you need a doctor on your side who's trained in biochemistry, because if you're lost, like, we got your back. So, and Dr. Bala in particular, so what, say somebody is like sending their estrogen down this particular pathway, what are some of the kind of factors that can make you switch from the healthy pathway to maybe the pathway that's going to give you more symptoms?
Ooh, so there's a lot of things that can influence that. Stress is a huge one. Obviously, I don't know anyone that lives in this world that doesn't have stress, so that's obviously a huge factor for most people. Genetics does play a part of that. There is some genetic component, but that's not to also say that, you know, epigenetics is involved and you can't change that genetic behavior. Your environment, kind of all of the xenoestrogens around you, you know, with plastics and pesticides and all of the other chemicals that we're breathing and eating. So those can play a huge part. And then obesity is also another one that we see linked to, because there's just so much peripheral conversion of estrogen, and you just make more estrogen when you have more fat tissue.
So yeah, did you hear that, guys? So fat tissue actually makes more estrogen, and so you are more likely to have symptoms of excess estrogen if you have more body fat. So that's part of why a functional doctor will help you try to lose, and it's part of why Dr. Bala has a ton of videos on nutrition and how it's related to hormones. You should check them out on TikTok. Yeah, definitely. So what are some symptoms that would cause a woman to know, okay, maybe I have a problem with estrogen, or maybe I have some estrogen?
Sorry, say that last part again.
Yeah, that's okay. What are some symptoms that would kind of let a woman know she have a problem with estrogen?
Yeah, so that could be anything from breast tenderness before your periods, acne can be an issue, really heavy periods. And I don't know if people know what heavy periods means. Basically, more than 80 milliliters per your entire flow of your period. So you can track that by figuring out how often you change your tampons, how full they are. I think the supers hold about 5 milliliters. Regulars hold 3 milliliters. If you have a cup, it tells you exactly how much it holds. So it's not a total, 100%. Like, we don't know exactly how much you're losing, but it's kind of an estimate. Like, if you're estimating more than 80 milliliters of blood being lost, then that's definitely a very heavy period. And so that's kind of how you track that. Painful periods, if they're not helped by pain meds, or you just feel like you have to take pain meds or you can't really function, that's a super painful period. Breast tenderness, I think I already said that. Acne, mood changes, irritability, things like that.
Let me just check, because everything that you just said, most women honestly think that those are normal. And so I want to get into this idea a little bit, like, is it possible to not have those symptoms with a period?
Yeah, I mean, when you have a healthy cycle and your estrogens are going down the right pathway, and your sleep is in check, your stress is in check, your diet is in check, your exercise, like all of those pieces that we don't always look after, when all those pieces are in check, you shouldn't have issues with your period. Like, you should, obviously you're gonna have discomfort, and I never want to say like, oh, you'll have like a seamless period and you won't even know it's there. Like, obviously your uterus is trying to squeeze that lining out. Like, you're gonna feel something, but it shouldn't interrupt your day.
Okay, everyone, take a deep breath, internalize this message. That is a pretty revolutionary message, honestly.
I am shocked at how many people think it's normal. I mean, I thought it was normal until like I got into all of this. I was like, oh, like I just have period cramps. It just is what it is. Right. I'll deal with it for the rest of my life.
Yeah. So Dr. Bala and I, just for anybody who doesn't know, we went to naturopathic medical school, which means that we got extra training in nutrition, in biochemistry, in herbal medicine. So a lot of the foundations of health that are supposed to prevent chronic illness. And honestly, period pain and hormonal dysfunction is part of what we are trained to prevent. Dr. Bala went and sought out tons of extra training in women's health. She did tons of extra preceptorships and internships, and she went to conferences, and now you work at a practice where this is all you do. And so I just want to ask you, like, in your clinical experience, do you see women who, had a ton of period symptoms and now they're having a period that's pain-free?
Yeah, absolutely. Oh, totally. Yeah, it's super exciting. I know when someone tells me like, oh my God, my periods were like so much lighter, or like they didn't hurt, I was like, I get so excited. It's the most exciting thing to hear.
Amazing. Okay, and so we've got people like writing in tons of comments and questions.
Perfect. Awesome.
Asking, like, okay, so my period does stop my day. I am having these symptoms. So what should I do? So where do you kind of start with people when they ask that question?
So I mean, again, I would like to test. It's always hard to say because it could be excess estrogen. It could be that you have a lot of that 4OH pathway, or your estrogen getting metabolized. It could also be that you're not making enough progesterone. So that could also look like symptoms of estrogen dominance without your estrogen even being that high. So it's always good to see whether is it truly low progesterone, is it truly high estrogen, or maybe it's a combination of both, and usually it is. It's usually a combination of both of those things. So obviously testing is going to be the first place I start, and then from there we kind of see, okay, where should we tailor it, and do you need more support there, or do you need more support with maybe liver metabolism and kind of clearing out those estrogens, phase 1 and phase 2. Maybe it's in your gut health and clearing out the estrogen there. Maybe it's supporting your hypothalamic pituitary ovarian axis so that you can make more progesterone. So there's a ton of different things that we can attack, but we obviously have to know what's going on first.
Right. So you kind of start and go to your doctor and maybe get a baseline evaluation. Just check, where's your estrogen at? Where's your progesterone at? Now, if you go to an OBGYN, let's talk about this for a second. OBGYNs are amazing. They're magicians with vaginas and uteruses and ovaries, okay? Like, we are such fans of them. But if you go to an average OBGYN, are they going to do this type of testing, or would you have to really have a conversation where you ask for specific things?
I would say, it's very individual on the practitioner. I have some OBGYNs here that are a little bit more holistic, but even they are a lot of the times like, I don't even know about the Dutch test. Like, what do you do? What do you do with that? I have some that I work with. So most of the ones that I know of they don't know about the Dutch test, or they don't know what to do with the information from the Dutch test, because their paradigm really involves birth control, metformin if you're, PCOS, insulin resistant, or drugs like fertility drugs to help you ovulate and things like that. So their world just doesn't involve using some of the tools that we have. So I always say I never can ever replace your OBGYN. I'm not here to do that. So I like to work with your OBGYN to make sure that, all the big scary stuff is ruled out. I can't do imaging. I can't really do an ultrasound for you. I can't do the biopsies. I don't do any of that stuff. So I really want to make sure you go to your OBGYN and she takes care of all of those things. And when everything looks good and we have all the reports back, that's when I'm like, okay, let's do a Dutch test. Let's figure out what's going on with your hormones.
Beautiful. Yeah. And just so everybody knows a little bit. So OBGYNs are MDs, medical doctors. They get a lot of training in things, pharmaceuticals, and the same basic sciences that Dr. Bala and I got during our schooling. But then they really sort of specialize, and a big part of their toolkit is either surgery or pharmacy. And so sometimes when it comes to the nutritional therapy, they don't have as much education because the general MD only gets about an hour of nutrition education in their school, whereas Dr. Bala and I got several years. And so it's just really knowing who you need at the time. So your OBGYN can have the initial conversation with you where you can really talk about what's going on. But if you feel like you get to a place where you want to start to know how to use food, how to use herbs, and really heal, you might need to seek out somebody with more nutrition training. Naturopathic doctors are a great option. Yeah, and really hop on Saru's TikTok or Dr. Bala's TikTok, and honestly, start to educate yourself. Just leave them on and scroll through. You're gonna learn so much. But this is part of
the cutest. Thank you.
It's serious. I'm serious, and people this is why you kind of need a team. So don't be afraid to
Absolutely.
expand your team if you're not getting enough answers from the doctor you're currently working with, because there are so many other options. So let's talk for a minute about gut health, because you mentioned that earlier.
Yes.
Yeah, and okay, so what do you wish more people knew about how the gut was related to hormones?
I just wish people knew that it was even related to hormones.
Yeah, that's fair. Let's start there. Guys,
Yeah, because I just feel like people are like, oh, like, what does my poop have to do with my periods? Like, so much. Oh my God, so much. It's crazy. So there's something in our gut called estrobolome, which is like my favorite word to say. And if our gut health, what that does basically is the conjugated estrogens that your liver made and sent out for excretion, estrobolome, if you have too much of that in your gut, it can actually undo that conjugation and put those estrogens back in circulation. So especially for women who have those issues with the estrogen dominance type symptoms, you're really going to see a lot of that overgrowth of that, that estrobolome kind of just being out of balance. And we can see that when your gut flora is just kind of off with the good bacteria kind of being outnumbered by the bad bacteria, and to say it in a short way.
I love it. You summarized that so well. And I want to back up. So for somebody who doesn't really understand the biochemistry of estrogen, we make estrogen every month, and we're supposed to get rid of it and then make more and then get rid of it. And then it stays really balanced, right? When you're making as much as you're getting rid of. You don't want estrogen building up, because this is what Dr. Bala was talking about earlier, where you get that estrogen imbalance, where you have estrogen that's too high and it's making the tissue in your uterine lining overgrow and giving you painful periods. So this estrobolome, which is like, so, for me, so hard to say, but yeah. So there can be a couple factors in making your estrogen stay high, and one of them is if your gut is not getting rid of it. And so that's why Dr. Bala does all this specialized testing to check on what's exactly going on in your gut. And so it's interesting because I think that's probably news for a lot of people.
Absolutely.
And probably they've never had a doctor ask them about their gut if they come in with period symptoms.
Right, exactly.
Yeah.
Yes.
Yeah. So what are some things that you tell people to look for to see if they might have an issue with their gut?
So definitely if you're not pooping every single day, I like to make sure. I know I get a lot of flack about that, because a lot of people are like, well, it's normal to poop, once every or 3 times a week even. And it's like, right. Yeah, sure. But like, again, we get back to like, it's common, but does that mean it's healthy? Probably not. If we're eating every single day, most of us eat at least 2 to 3 meals a day. Yep. Where is that going? Like, if you're pooping 3 times a week, where is all of that food? It needs to be coming out. And so I always like to say, if you're not pooping every day, that's a great check in, like, okay, how is my gut health? Another one is like, how do you feel after you eat? Do you feel really tired? Do you feel really bloated? Bloating is not normal. That's another one where it's like, okay, most of us have it, just like period pain, but we don't have to deal with bloating. It's really not as normal as we have tried to normalize it into being. So yeah, how do you feel after you eat? Other symptoms like acid reflux or nausea, abdominal pain, when you're going to the bathroom, if you're having to strain and it's like really hard to get out, or you don't feel like you've completely gotten everything out, all of those are signs that like you just need a little bit more support with your gut health.
Okay, beautiful. So guys, again, I want to so you're saying you should be able to have an easy to pass, like normal bowel movement once a day, no problem. And that after you eat, you shouldn't feel bloated or tired, bad. Exactly. This is your birthright, everybody. Like, you don't have to feel bad after you eat. You heard it from Dr. Bala. It's official. So, yes. But people might need a little help to get there. So, and that's why you should seek out a trained professional to work with. And I think one of the things that we talk about a lot in my clinic, and I want you to chime in here, is just fiber. Yeah. If you spend one day, write down everything you eat, put it in like MyFitnessPal or Chronometer or some kind of tracker, and see how much fiber you got. Because most people are getting 10 grams or under. And if you need to actually be getting at least 25, probably 30, to have a healthy gut. So, and this is not a naturopathic idea, right? Like, this is an idea. Yeah, go to the MD or the gastroenterologist, and they're going to tell you to prevent colon cancer, you need to get at least 20 grams of fiber a day.
Exactly.
people are taking Metamucil and fiber supplements, but you don't have to do that.
Right.
Just eat plants. You can eat things like chia seeds and flax seeds. So are there certain fixes to people's diets that you find are like common that they need to make to optimize their gut health?
I think it's different for everyone. I know dairy, I mean, I hate having to villainize dairy, but that is just the one that I find most commonly, especially if you have hormonal problems. Dairy seems to be the culprit. That's always the common link for every woman that I've been seeing is once they cut that out, their gut improves, their acne improves, their period pains improve. It's crazy how much dairy can have an effect on so many systems in our body.
So that's an interesting experiment that you guys could like safely do at home. You could swap out your cow's milk for some coconut milk for a week. See if it makes a difference.
Yeah,
things like staying hydrated, eating more fruits and veggies are like kind of no-brainers. But if that doesn't work, Dr. Bala, it sounds like there are more things that you can do. So
yes. So we can also do food intolerance testing. We can do stool testing. Food intolerance testing is my favorite way of kind of figuring out maybe if you still have a lot of these symptoms of like you're constantly bloated, you're feeling really tired, you have a lot of brain fog, you're just exhausted all day even after you've slept like a full night's sleep, or you're having trouble sleeping, all of those things. Even though you've like changed your diet around, you're eating more fiber and nutrients, less processed food, but you're still like, oh my God, there's something still wrong with my gut. And we can do food intolerance testing. You can also try an elimination challenge. That one's just a lot harder for a lot of people to do. So food intolerance testing isn't 100% accurate, but it is a nice guide that we can kind of see, okay, this is what's going on. These are the foods you're reacting to. We cut them out for a couple of months while we do some gut healing things, and then start reintroducing that back and see how is your body now able to tolerate those. And usually, aside from like a couple things, most people are able to add in a majority of the foods back in. So it's not, I never like to be restrictive. I hate having to say, you need to be dairy-free, gluten-free, grain-free, all of these things free forever. I hate doing that because so many of us have like orthorexia and like disordered eating, and especially among women who have hormonal issues. I already know that's like half of my patient population. So I hate saying you have to cut these foods out.
Right.
But, if you are having lots of symptoms, I like to say, let's cut them out for a period of time.
Beautiful. So food sensitivity testing, guys, will check for if you're making immunoglobulins, which are markers in your immune system, to certain foods that you're eating. Because if you are, that's going to create chronic inflammation in your system. And Dr. Bala actually has some awesome videos on how it's related to what's called leaky gut. And so when you have those conditions, it creates a lot of inflammation. It creates kind of an unstable microbiome in your gut. And so it affects the way you metabolize food, digest food, and it can make the right foods wrong for you temporarily, right? Like tomatoes, an amazing food, right? They're so full of antioxidants, fiber, water. They're so great. But there are some people who, because of having maldigestion or because of having some sort of dysfunction in their gut, they can start having an immunogenic reaction to tomatoes because they're part of an egg family, which is allergenic. And then that could be playing a role in hormonal symptoms.
Yeah, it's funny you say tomatoes because I did my food intolerance test and tomatoes showed up. It was so bad.
And the good news is, so normally, and again, like Dr. Ball saying, she doesn't want to take food away from you. So if you swap those foods out for just a few weeks, your gut will start to heal itself. And that's what allows you to then add it back in because you'll be less reactive. So beautiful. I love it. And then you mentioned stool testing. So for people who don't know, let's talk to them a little bit about what a stool test is, what it's testing for, what information it gives us.
Yeah, so it gives us a lot of information into like what's going on with your gut microbiome. So we get to see kind of which bacteria are out. I know I can't even list off the top of my head. I know it tests like E. coli and that's the one I think of.
All the things.
Yeah, it has so many different bacteria in your gut, and so we can see if one is more out than the other. I know for a lot of people, Candida is well tested in the stool. We can kind of see if you have an issue there. So we really get to see what your microbiome is up to, what you have too much of an excess of, what you like are completely lacking, and we can kind of go from there.
Beautiful. And guys, like, I remember we learned this in med school and my mind was blown. You have more
microbial DNA in your body than your DNA, right? So like that means you have more DNA from bacteria, yeast, even some viruses in your body than your own human DNA. Like
no,
it's crazy. That's how much your gut being full of the right bacteria matters, because we have trillions of different organisms that live in here, and they help us digest food. They help keep our immune system up. And so that's why Dr. Bala is so passionate about making sure that you have the right bugs in your gut, because if you don't, it's going to give you more symptoms than just diarrhea or gas. It's going to affect the way you metabolize your hormones. So that's why it's so foundational. So I love that you test for that, because a lot of people don't. A lot of doctors just, you go into the doc and you probably have 10 different things going on. They only have 5 minutes to see you. You mentioned you pain. Maybe they send you to the GI specialist. They give you like Colace or right. And like if we're not testing and you're not sitting with somebody who has the time to really look at the test results and interpret them, then you're just not getting the full picture. So if you are still living with gut symptoms and you've got hormone symptoms, look at Dr. Bala's information, contact her on her site, seek out a naturopathic doctor near you. Like, you deserve to have a healthy gut and healthy hormones.
Yes.
Sure. Yes. So, okay, thank you for that. I had one more question for you, and then we're going to some of the questions that people have. I've been writing a few down as they come in.
Perfect. Okay.
Yeah. So, say somebody, they're like, oh, my gut's fine. I'm not overweight. I eat pretty healthy, but I still have period pain. What do we do then?
Well, I would like to see exactly what that means. So, like, for a lot of people, some people, there's a lot of genetic component, like with PCOS. That's usually the women that I see that the most common in, is they're like, well, I'm doing all the things and I'm doing them right. And it's like, that's when genetics is a huge factor. And sometimes your lifestyle has to just be a lot healthier and a lot more, I'm going to say self-care. You just have to have a lot more self-care than someone else who maybe doesn't have those genetic predispositions. So that's where it's like, you might have to just clean up your diet even more and take it a step further. Or maybe you need some liver support at that point. Like, your liver is just, if we think of our liver as the bathtub analogy, like the faucet is all of the toxins and everything in our life kind of coming in, but it's matched by the drain that's draining it out. And so if the water gets turned up too high, or if the drain gets clogged a little bit, then our bathtub overflows, and our bathtub is our liver. So, maybe we just need some help with lowering turning down the faucet or clearing up the drain. And that's kind of where we talk about liver support, eating more cruciferous veggies, lots of water, lots of water, more water than you would think. And obviously pooping every day too. So like all of the modes of elimination.
Perfect. Yeah. So I guess that's a really good point that you made of, thinking our diet is healthy and maybe we actually have some room to improve. So a lot of guys, what your naturopathic doctor is going to do, and what Dr. Bala definitely does, we look when you come in at the actual micronutrients that you're getting. So what kind of B vitamins are you getting? Are you getting enough omega-3s in your diet? Because it's not just, are you eating vegan, or are you eating paleo, or are you a vegetarian? Because there is a healthy way and a not healthy way to have a good diet. And so that's why you need somebody who's really grounded in nutrition, who's going to look at the nutrition content, what you're taking in, and not just sort of jump on this craze of, oh, if you're eating keto, you're fine. Because that's
exactly
right. There's a wrong way to do keto and a healthy way to do keto.
Exactly.
Or everybody needs to go vegan. Like, well, you can be a vegan and be eating like cereal.
Oreos are vegan.
Well, I didn't know that. Oh my gosh. I didn't know.
Like, oh my god, this is crazy. You would not think. Yeah. So there you go. Perfect example.
Perfect example. So yeah, come in, get your nutrition analyzed. Perfect. Before you just kind of decide, well, I'm doing everything, so my only option is the pill. So someone did write in, actually a couple people wrote in and asked this. They said, I'm curious if you think there's a type of birth control that's the best. And I wonder if when people ask you that, like, how do you talk them through that?
So I guess it depends what best means. If you're using it for contraceptive purposes, I would say whatever works with your body, whatever doesn't make you go crazy, because I know that's a huge issue for a lot of women, is they're like, oh my god, I feel crazy on birth control. So whatever works for you in that realm, if you're using it for contraceptive issues, then whatever you feel best on. And that's probably a better conversation to have with your OBGYN, because I don't usually prescribe birth control or manage that kind of stuff in my office. I'm usually helping people get off of birth control or dealing with some of the symptoms after afterwards. So I would definitely say that's probably a question best answered by your OBGYN, because she can kind of, or they can kind of guide you in whatever, different types of hormonal contraceptives would be best, or non-hormonal contraceptives as well.
Perfect. Yeah. And guys, so this is like, there's a couple different reasons that you can use birth control, right? And that's going to determine what. So if you're using it because you don't ever want to get pregnant, there are some options for you there. If you're using it temporarily, don't want to get pregnant, there's some more options for you. If you're using it because you want, like, you never want to have to think about taking a pill, that's going to change the type of options that you have. And so it requires a conversation. And that's why there's no one form that works best, right? It's about what works best in the moment. So I love an answer that's really empowering. And just make sure you are meeting with a doctor who's going to have that conversation with you.
Yeah, that is very important, is to make sure that your doctor is open to having a conversation. Because if they're not, please find somebody who will have that conversation with you, because a 5-minute impersonal, just take this, should not be accepted.
Right. Yeah, you're allowed to need more, and there are doctors who will give you more. So definitely advocate for yourself with that. Okay, perfect. And then another question came in. So this person's asking, my period used to delay 1 week each month, but now I'm starting to get it the same day. I'm not sure why it got changed. So when our hormones, first of all, is it normal for a period cycle to change throughout the lifespan? Or should, like, if you started getting it every 28 days when you were 18, should it stay the same for your whole life?
Ideally, it stays within a very small window. So if something, like, if it's like you always had, so basically when I started having hormonal issues, it was because mine was always 28 days. And then it started being an average of 27 and then 26. And I was like, okay, this trend is not looking good. So then I went and I was like, okay, what's going on? So if you see like a trend going down, if you went from 28 days and now you're at 26, but it's consistently 26, that's less concerning. Or if you went from 28 to 30, that's not as concerning to me. But if there's a trend going in one direction or another, or they're just completely unpredictable, that's when I'm like, okay, let's figure out what's going on with your hormones. But if you're going from 28 days to 27 days or 30 days, like it's consistent, then I'm less worried. But still, if you're having symptoms, you should test.
Awesome. Yeah. So I love that. It's like, it's within the context of your general health, guys. So like, if your period is, being 1 or 2 days different every month is your only thing you've got going on. Otherwise, like, you're waking up every morning with energy, you're happy, you can focus, your gut works great, you probably don't have to worry. But if it's part of a general picture of, you're not as healthy as you could be, chances are that's going to give your doctor a really good clue about what's going on with not only your hormones, but the rest of your body. So, perfect. Okay. I love that. And then I have a question for you, because I think I have a lot of women in my practice who have been on birth control to suppress their symptoms for years. Mm-hmm. And we do all the foundations of health stuff. And they are, again, their insulin's under control. They're eating tons of fiber, tons of omega-3s. They're getting tons of antioxidants. And they're scared to come off the pill because they're afraid that their symptoms are going to come back. They're not sure how long it will take their hormones to normalize. So how do you have that conversation with people?
Yeah, so, that is a legitimate concern. Like, you don't want to be back to where you were. And, if you're never, ever looking to get pregnant, maybe you don't need to do that. And that may be a conversation that you need to have with yourself and your doctor. Otherwise, I would say yes, it's something that's going to be hard in the moment, but in the long run, it'll be easier for you. So you can choose to do the hard thing now or the hard thing later. You know what I mean? So it's like, we can work with you to make sure that when you're getting off of your birth control, there's a lot of things we can do to support your liver, to support your gut health, to support your overall health, and make sure that, one, you're getting rid of all those extra hormones that are in your birth control and whatever hormones are in your body when you're coming off of them, to support your nutrients that maybe the oral contraceptives have depleted. There may be a lot of other things we can do, like I said, with your gut health. I'm always going to go back to gut health, and of course stress management. That's a huge one too for so many people. So there's so many things we can support, and you don't have to feel bad, and then you don't have to feel anxious about being on birth control either. So it's like there is a way out of it. It just does require some upfront effort from you, but after that you will feel better.
Okay, perfect. So, and I'm going to summarize real quick. So guys, I think this is an important point. I guess I love that you said this. You're going to have to go off it eventually, right? whether you're like 50, maybe not, hopefully earlier than that, but eventually you're going to go off birth control. And if we haven't cleared up those underlying issues, the symptoms are going to come back. And so what we'll do with a natural approach, and what you do with the women, is you work on getting rid of any of the issues that could contribute to the pain and dysfunction that are being suppressed by the birth control. Clear those up. And then you support the woman as she comes off. And how long would you say, do you generally tell people like 2 months, 6 months, a year?
I don't really like to give a timeline because it's different for everyone. Depends. Like, did you have hormonal issues before going on birth control? How long have you been having these issues? Did you develop them while you were on birth control? And like, what does your everyday life look like? Is it, fairly healthy or active? You're eating well, you're pooping well already? Because then it's going to take less time. If you've had chronic issues and you've had lots of symptoms, it's probably going to take a little bit longer.
Okay, perfect. Yeah, so it's individual for everybody, guys. But what I'm hearing, though, is, okay, we can't tell you, we'll tell you once we meet with you, exactly, like probably how long you can expect.
Right.
But at the end of it, you will feel better.
Yes. Hopefully. That's the goal. That's the goal.
Yeah, love it. So let's talk a little bit about the naturopathic approaches that you take to supporting women with those symptoms, right? So like a lot of what we talked about, like breast tenderness, period pain, what would you kind of bring on board to support somebody who's making the transition from maybe suppressing their symptoms with birth control to using a natural approach?
Mm-hmm. Yeah, so generally, like if we do the Dutch test and we see that their 4-OH is really high, their estradiol is really high, and their methylation is really low, their active methylation activity is low, it tells me their liver needs some support. They have really high estrogen. So to kind of push that 4-OH pathway towards that 2-OH pathway, things like sulforaphane or DIM are really helpful. DIM lowers your overall estrogen levels, though. So if you have a lot of estrogen going down the 4-OH, but your overall estrogen is pretty low, I would not consider DIM. I would probably do things like sulforaphane, broccoli sprouts, cruciferous veggies to kind of push you more towards that 2-OH pathway, because that helps to support that phase 1 of liver metabolism and estrogen. If you're having some trouble with methylation, I would consider adding in lots of B vitamins, magnesium, vitamin C. NAC is a really good one for that phase 2. Glutathione maybe. Lots of elimination, sauna, sweating, biking, cardio, exercise, whatever you can do to get yourself sweating at least 30 minutes every day. That's going to be really helpful for supporting your liver too. And then, yeah, those are kind of the main things that I like to use.
Awesome. And then there are some herbs that we were taught about in school, and I know that you use in your practice too, to help with things like really intense cramps or period pain. I want to, let people know, just so they know that there are options, like what are some of the herbs that come to mind that you would consider?
So this one, I really like red raspberry leaf tea. I like it as a tea because, I feel like it's cool to be able to drink your medicine and not have to take and pop so many pills all the time. So that one works really well for some women. Some women just completely swear by that, and some women are like, this did nothing for me. So it's kind of hit or miss. Seed cycling is another one that can be also very helpful for some women. Again, hit or miss on whether that works for you. But, either of those, you're not really going to be hurting yourself in doing, because adding some seeds into your diet is never going to hurt anybody. So if it works for you, that's amazing, and you had great success. If it doesn't work for you, you're getting more nutrients. So worst comes to worst, you're eating more seeds. So that one, Vitex is another good one if your progesterone levels are pretty low. And what else? I feel like you might even have more ideas.
Well, people ask me a lot about cramp bark. I think that's like one that everybody hears about. So I would love to have you give your take on cramp bark. And
I love cramp bark. You know what? I don't even use that one very often, and now that it's on my radar, I need to start recommending that one more often. That's another really good one to use. I know evening primrose oil, some people can cycle it like in their follicular phase versus luteal phase or vice versa. That can be really helpful. Surprisingly, paced breathing is one I tell every single patient to do paced breathing every single night. So if you're my patient, you're going to be getting that recommendation because there is no one that it can't benefit. And just reducing your overall stress, sleeping a little bit better can reduce some of that like inflammatory markers in your body already, and that helps with your pain. So Magnesium. Magnesium's another great one too. I really love magnesium.
You guys can see the list goes on and on and on, right?
There's so many things.
Yeah, and don't go home and buy all these from Amazon.
Yes,
like,
don't.
Work with somebody who's going to evaluate. Like, you've heard Dr. Bala again and again go back to this saying of, like, we need to test first. We need to test first. Like, we need to know what's going on before you just start taking all of these supplements or herbs. The other thing is, guys, like, eventually the goal with all of this is that you'll learn to get all of these substances through diet. So magnesium, we talked about seeds. So seeds contain specialized fatty acids. And most people don't know that fatty acids go in and inhibit the enzyme, which are the two major chemical mediators of inflammation in your body. Mm-hmm. So when you eat things that are high in omega-3s, in particular, it suppresses inflammation. Kind of like it's very similar actually to taking ibuprofen, but most people don't know about it. So
there's actually this thing, the ibuprofen test. So people with really painful periods can 3 days before their period and then while they're on their period for 3 days take ibuprofen, and if they notice that significantly improves their period pain, then we know that you just have a lot of prostaglandins and a lot of inflammation going on.
There you go. Easy test, guys. Yeah, that's great. That's amazing, right? And then we can bring natural anti-inflammatories on board. Exactly. So this is great. Okay, so people need more of you. So where can they find you? First of all, let's talk about that. Where can people see your content and get in touch with you?
Yeah, so Instagram, like you mentioned, my TikTok, my website, you can go there. You can message me on Instagram. You can find me if you're in Arizona. You can find me here, or I also have a virtual practice. So I'm pretty accessible. I like to be accessible.
Get in now, though, guys, because Dr. Bala has a waiting list until September. So, like, don't wait, is what I'm saying. The other exciting thing that I want people to know about, so you have a course that's coming out sometime in the next couple months where you're going to help women understand their hormones. You're going to take them through this in a really step-by-step way. So can you talk a little bit about what's going to be in that and how people can stay tuned?
Yeah, so basically it's going to include everything we talked about, just a little bit more, like, structured and in a class-type format. I will talk about kind of what a normal period looks like, what your hormones are doing, what we test for, what the Dutch test looks like, what the food intolerance test looks like, what the stool testing looks like, what your OBGYN might order for you, and what those lab tests look like. I'll go through what birth control is, how it works, the different types, how to transition off of birth control, how we can support that, the nutrients that it depletes. So we talk about how to support your liver health, your gut health, foods to eat, a specific type of diet to follow. I talk about the most common hormonal conditions. I think it was PCOS, hypothalamic amenorrhea, excess estrogen, Hashimoto's, maybe a couple others that I'm forgetting, but I just kind of go through like some of the most common hormonal complaints that women have. And then we'll kind of also talk about cycle tracking. How do you track your cycles? How do you track ovulation? What tests to use? So there's a lot of fun information. I'm excited.
That's a lot.
Yeah.
That's great. I know. Everyone's like sending hearts right now. They're like, yes, we need this information. Okay, great. So people should they just follow you on Instagram and sign up for your newsletter?
Yeah, I have a newsletter. I'm really bad at updating it. I'm sorry, you guys, but
You're busy. You have the wait list. Yeah. So let's go. Yeah.
But hopefully soon, whenever that course comes out, I'll be like updating everyone. Hey, this is releasing soon, and just get on the list to buy it, or this is how you can sign up for it. So I'll definitely be updating everyone there. Obviously, I'll probably make an Instagram post. I'll definitely be posting videos on TikTok about it. So I will make it very clear that this is available.
Awesome. Okay. Well, thank you so much for spending this time with us.
Absolutely.
Today.
Thank you. Thanks for arranging it. I'm glad.
Oh my gosh.
I love this.
Me too. We should do it again. And really, I just want to say thank you so much for doing what you're doing in the world, because there are so many women who are looking for answers. And really just watching 2 of your videos, people feel so much more hope. So guys, seriously, go follow Dr. Bala. Stay tuned. I will let you know when her course comes out too, so you can go buy it right away. And in general, yeah, we'll all walk together through this so that we can get you to your best health. So yeah, okay. All right, so thank you again. And guys, just message us if you have more questions after this. Yes, and we'll do this again soon.
Yay. Thank you,
Yay.
Katie.
Bye, love.
Bye.